The human body is a complex network of systems, and among the most intricate is the endocrine system. It acts as the body's communication network, utilizing hormones to relay messages between different organs and tissues. These hormones regulate a multitude of functions, from growth and metabolism to mood and reproductive processes. Understanding this system is crucial for anyone in the healthcare field, especially for those preparing for the family nurse practitioner exam. Hormones are secreted by glands such as the thyroid, pancreas, and adrenal glands. These glands release hormones directly into the bloodstream, allowing them to travel to distant organs and tissues to exert their effects. The precision of this system is vital. Even small imbalances can lead to significant health issues. For instance, an overproduction or underproduction of hormones can result in conditions like diabetes or thyroid disorders. For FNP exam preparation, knowing the locations and functions of these glands is essential. The pituitary gland, often termed the master gland, controls other glands and is pivotal in the regulation of hormonal balance. The thyroid gland, located in the neck, plays a crucial role in metabolism and energy regulation. Meanwhile, the pancreas, nestled in the abdomen, is integral to blood sugar control, making it central to understanding diabetes. In the upcoming sections, we'll delve deeper into common endocrine disorders, focusing on diabetes and thyroid conditions. By examining their pathophysiology, symptoms, and treatments, you'll gain a clearer understanding, crucial for both exams and real-world practice. This foundational knowledge will equip you to handle these conditions with confidence and competence. Diabetes mellitus type 1 is an autoimmune condition where the body's immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. This destruction leads to absolute insulin deficiency, necessitating lifelong insulin replacement therapy. Unlike type 2 diabetes, type 1 is not linked to lifestyle factors but is believed to have genetic and environmental triggers. The onset of type 1 diabetes is often abrupt and can occur at any age but is most commonly diagnosed in children and young adults. Patients typically present with classic symptoms such as polyuria, which is increased urination, polydipsia, meaning increased thirst, and polyphagia, or increased hunger. Weight loss, despite normal or increased appetite, is another hallmark symptom due to the lack of insulin and subsequent inability to store glucose in cells. Early recognition of these symptoms is vital, as untreated type 1 diabetes can rapidly progress to diabetic ketoacidosis, a life-threatening condition characterized by high blood sugar, ketone production, and acidosis. Diabetic ketoacidosis requires immediate medical attention and is a key area of focus for both the FNP exam and clinical practice. In summary, understanding the autoimmune nature and the acute presentation of type 1 diabetes is essential for effective diagnosis and management. Early intervention can prevent complications and improve patient outcomes, making this knowledge critical for aspiring nurse practitioners. The cornerstone of managing type 1 diabetes is insulin therapy. Since the body cannot produce insulin, patients must rely on external insulin to regulate their blood glucose levels. This involves a combination of basal insulin to manage blood sugar between meals and overnight, and bolus insulin to cover the carbohydrates consumed during meals. Insulin can be delivered via injections or insulin pumps. In addition to insulin therapy, education on carbohydrate counting and blood glucose monitoring is crucial. Patients learn to adjust their insulin dose based on carbohydrate intake, physical activity, and blood glucose readings. Continuous glucose monitors are increasingly used to provide real-time glucose data, helping patients make informed decisions about their insulin needs. Managing type 1 diabetes also involves regular follow-ups to monitor for complications such as retinopathy, nephropathy, and neuropathy. These complications arise from prolonged periods of high blood sugar and require diligent monitoring and control. Patients should be educated about the importance of regular eye exams, kidney function tests, and foot care. Clinical pearls for the FNP exam include remembering the so-called honeymoon phase, where some patients experience a temporary remission with reduced insulin requirements after diagnosis. It's also important to be aware of the signs of hypoglycemia, a potential danger zone, characterized by sweating, tremors, and confusion, which requires prompt administration of glucose. Diabetes mellitus type 2 is characterized by insulin resistance and relative insulin deficiency. Unlike type 1, the pancreas still produces insulin, but the body's cells become resistant to its effects. This insulin resistance often develops over time, influenced by factors such as obesity, a sedentary lifestyle, and genetic predisposition. As a result, the pancreas struggles to produce enough insulin to overcome this resistance, leading to elevated blood sugar levels. Symptoms of type 2 diabetes are similar to those of type 1, but often develop more gradually. These include increased thirst and urination, fatigue, blurred vision, and slow-healing sores. Due to its insidious onset, type 2 diabetes might be diagnosed during routine blood tests before symptoms become apparent. This slow progression is a key differentiator from the abrupt presentation of type 1 diabetes. A significant percentage of type 2 diabetes cases are associated with metabolic syndrome, a cluster of conditions including hypertension, dyslipidemia, and central obesity. Recognizing this syndrome is crucial for comprehensive management and is frequently tested on the FNP exam. Understanding the pathophysiology of type 2 diabetes allows for targeted interventions, which we'll explore in the next section. Emphasis on lifestyle modifications and early detection is essential in preventing complications and improving patient quality of life. So, the management of type 2 diabetes begins with lifestyle modifications, including diet and exercise. Encouraging patients to adopt a balanced diet rich in whole grains, fruits, and vegetables, while reducing processed foods and sugars, is really fundamental. Physical activity, like brisk walking for at least 150 minutes per week, enhances insulin sensitivity and aids in weight management. Now, pharmacological interventions become necessary when lifestyle changes alone are just not enough. Metformin is often the first-line medication due to its efficacy in lowering blood glucose and its favorable safety profile. Other options include sulfonylureas, GLP-1 receptor agonists, and SGLT2 inhibitors. Each class of drugs has unique mechanisms and benefits, which should be tailored to individual patient needs. Regular monitoring of HbA1c levels, typically every 3 to 6 months, is essential to assess long-term glucose control. The goal is to maintain HbA1c below 7% for most patients, although individual targets may vary. Keeping blood pressure and cholesterol levels within target ranges is also crucial to minimize cardiovascular risks. For the FNP exam, remember that type 2 diabetes management is multifaceted, involving lifestyle changes, medication, and monitoring for complications. You should anticipate questions on medication side effects and contraindications, since these are common exam pitfalls, and emphasizing patient education on recognizing symptoms of hypo and hyperglycemia is also really vital. Graves' disease is an autoimmune disorder that leads to hyperthyroidism, where an overactive thyroid gland produces excessive thyroid hormones. This condition is more prevalent in women and is characterized by the production of antibodies that stimulate the thyroid gland. The excessive hormones accelerate the body's metabolism, leading to a variety of symptoms. Patients with Graves' disease often present with symptoms such as weight loss, despite an increased appetite, palpitations, heat intolerance, and nervousness. A noticeable feature is the presence of a goiter, which is an enlarged thyroid gland, and exophthalmos, or protrusion of the eyes, which is more specific to Graves' disease compared to other forms of hyperthyroidism. The thyroid storm is a life-threatening exacerbation of hyperthyroidism and is an important danger zone for both exams and practice. It is precipitated by stress, infection, or surgery, and presents with fever, tachycardia, and altered mental status. Immediate recognition and treatment are crucial. For the FNP exam, it is essential to distinguish Graves' disease from other causes of hyperthyroidism through clinical features and diagnostic tests. A high index of suspicion and thorough history taking are key, as early intervention can prevent complications and improve patient outcomes. The management of Graves' disease aims to reduce thyroid hormone production and alleviate symptoms. Antithyroid medications such as methimazole and propylthiouracil are commonly used to inhibit thyroid hormone synthesis. These medications require regular monitoring of thyroid function tests to adjust dosages and prevent overtreatment. Radioactive iodine therapy is an option for those who do not respond to medications or have contraindications. This approach involves the oral administration of radioactive iodine, which selectively destroys overactive thyroid tissue. While effective, it may lead to hypothyroidism, necessitating lifelong thyroid hormone replacement therapy. In cases where medication and radioactive iodine are unsuitable, surgical removal of the thyroid gland, known as thyroidectomy, may be considered. This option is more invasive and requires careful preoperative preparation and postoperative monitoring for complications, such as hypocalcemia and vocal cord paralysis. Clinical pearls for the FNP exam include awareness of the side effects of anti-thyroid medications, such as agranulocytosis, and the importance of patient education on symptom monitoring. Recognizing the signs of thyroid storm and knowing the emergency management protocols are crucial for safe practice. Hashimoto's thyroiditis is the most common cause of hypothyroidism, which is an endocrine disorder characterized by insufficient thyroid hormone production. This autoimmune condition leads to chronic inflammation and gradual destruction of the thyroid gland. It's more prevalent in women and often presents in middle age. Common symptoms of hypothyroidism include fatigue, weight gain, cold intolerance, constipation, and dry skin. Patients may also experience depression and cognitive slowing, which can often be mistaken for other conditions. The presence of a goiter, although less prominent than in Graves' disease, can also occur. A key danger zone for the FNP exam is recognizing myxedema coma, a severe form of hypothyroidism that presents with hypothermia, altered mental status, and bradycardia. It requires urgent medical intervention and is commonly tested due to its critical nature. For efficient diagnosis, laboratory tests showing elevated thyroid-stimulating hormone or TSH and low free thyroxine or T4 levels are indicative of primary hypothyroidism. Understanding these laboratory parameters is crucial for exam preparation and clinical practice. The primary treatment for hypothyroidism is thyroid hormone replacement therapy, typically with levothyroxine. This synthetic hormone restores normal hormone levels and alleviates symptoms. Dosing is individualized based on patient age, weight, and the severity of hormone deficiency, with regular monitoring of TSH levels to guide adjustments. Patient education is vital, emphasizing the importance of medication adherence and consistent timing of doses, ideally on an empty stomach for optimal absorption. Patients should be aware of potential interactions with certain foods and medications that can affect levothyroxine efficacy. For the FNP exam, recognize the importance of identifying symptoms of overtreatment such as palpitations and weight loss, which are indicative of iatrogenic hyperthyroidism. Additionally, be familiar with the management of myxedema coma, a rare but life-threatening complication requiring prompt treatment with intravenous thyroid hormone and supportive care. In summary, differentiating between hypo and hyperthyroid conditions and understanding their management is essential. For exam success and clinical competence, focus on recognizing key symptoms, understanding treatment protocols, and being aware of potential complications and emergencies.